Here's a T1 weighted fat saturated sequence with intravenous contrast, and you can see around the aorta there's a soft tissue mass that extends around the left common iliac artery. We can see that that mass actually narrows the artery here. The other thing to note is this rounded structure right here that ends up being the ureter. So this mass is involving the ureter and causing a degree of obstruction. And so the main point behind this is how would one approach a biopsy of this lesion. Now here you can see the iliac bone right here. You can see a transverse process. You can see the sacrum coming here, and this is the bulk of the mass right here and a little higher up. And there's not really a good window to be able to come posteriorly to be able to target this mass. So the approach that we ended up using was to tilt the angle of the gantry so that we were able to come up from a higher position between the transverse processes, but actually aim the needle down inferiorly into the bulk of the mass. And I just wanted to show you what that looks like. So here's the CT that was performed, and this is with the tilt of the gantry. And so here's the mass right here. There's actually a ureteral stent that was placed, which is quite helpful to avoid injury to the ureter. And you can see that we ended up choosing an approach that approximated this kind of position. The problem associated with this, however, is that we know that the iliac artery is somewhere in here, so we want to make sure and confirm that that is indeed a good position. So we ended up repeating this with contrast, and you can see here's our target, here's the ureter over here, and then here's your iliac artery, and we have this area of tissue right here. So we ended up confirming our position here. Here is our introducer. We can see we pulled back the inner stylet to be able to decrease the beam hardening artifact, and you can see that this approach, actually the beam hardening artifact, shows our trajectory, and this is clear of your iliac artery and clear of the ureter, so that's where we ended up biopsying. So I think this is a good case just to illustrate the importance of tilting the angle of the gantry to be able to get a better biopsy approach, and then also the importance of the use of contrast either as pre or right before you do a biopsy from the planning standpoint, or right before you do a biopsy, the importance of giving contrast just to make sure that the approach is actually a safe approach. And so this ended up being retroperitoneal fibrosis.